Welcome back to TV5 News at 9. Today we are talking about elective surgeries during this coronavirus pandemic. Joining us this morning is board certified neurosurgeon Dr. Jagannathan. Thank you so much, Dr. J, for being here this morning.
Morning, Colette. Thanks for having me.
You're welcome. Okay, so many patients have questions this time during this pandemic. Should I get elective surgery, and what factors should they consider when they make that decision, Dr. J?
So the decision to make surgery is a very highly individualized decision, particularly neurosurgery, that a patient makes with a consultation with a surgeon. And it's really dependent on multiple factors: the patient's symptoms, the presence of neurologic injury or deficit, and the findings on MRI imaging. And in certain cases, even with COVID, surgery may be indicated or necessary to prevent long-term morbidity or even mortality in some cases. So elective surgery sometimes is necessary during the COVID pandemic, and it is something that we're doing fairly regularly in patients who need it. There are certain cases where, particularly with active COVID or patients who have positive tests, where it may be beneficial to put off elective surgery if symptoms are not severe or manageable. But there are other cases where surgery may be required.
And tell us about those precautions that can be taken during surgery to prevent transmission, Dr. J.
So there are a number of precautions that are taken. COVID, as you may or may not know, is typically transmitted via aerosol spread, via droplet spread, which means that there are particles of the virus and droplets, for example, when you sneeze or cough. So a lot of it is to prevent the droplet transmission. So precautions include things like protective equipment that we all know about. There is oftentimes reverse pressure operating rooms, meaning that when the doors are open, the pressure tends to suck particulates in as opposed to going out to the hallway where it could affect other people. Dedicated anesthesia equipment for patients who might have COVID, extra time between cases, cleaning extra, and even in cases where patients are COVID positive, taking extra precautions, leaving them in the operating room a little bit longer when they're extubated, so that if they cough or other things, that it doesn't risk spreading it to other patients.
Well, that should really put patients' minds at ease. Thank you for that, Dr. J. Now, also joining us from McLaren Bay region is Magen Samyn. Now, thank you for being here. What precautions are hospitals taking, Magen?
Well, thank you for having me. McLaren Bay region continues to do what's best for our patients and our staff to keep them safe. We follow the CDC recommendations and continue to work with our local health departments to ensure we're doing everything that is recommended. Our environmental services team continues to take rigorous precautions in cleaning all areas, especially those with high touch points. Our clinical team, as Dr. Jagannathan mentioned, wear the proper PPE or proper protective equipment to keep them safe. And that may include goggles or masks and gowns, and continue to wash in and wash out after every patient. And we continue to follow those protocols to make sure that we're keeping our patients safe. Currently, right now, we are under more precaution and continuing to limit the number of individuals into our hospital to keep our patients and staff safe. And everything that we do is always to keep the patient safety in mind.
And Megan, so many people are apprehensive during that time about doing any type of activity. What advice do you have for patients who may be still leery about surgery?
We need to continue to have the conversation with them to ensure that they don't delay care, because sometimes delaying care will have more of an adverse reaction or outcome for them than not coming in to receive care. And so we want to make sure that they know that we are doing everything we can on our end with our staff and our precautions to keep them safe and to ensure that they are not delaying the medical care that they need going forward.
Yeah, so it's more important to come in and get the care they need, because you are making sure that they're safe and healthy. And that's their first priority. Thank you so much. I appreciate you for joining us today.
Thank you.
Thank you.
And if you'd like any more information about today's topic, check out the hot link section at WNEM.com.